Hello everyone, welcome to Chalk Talk, Voices, Values and Vision, where we talk about topics that matter to students. On today's episode number 3, we are going to talk about protecting childhood from screen, mental health, attention, where we'll explore how children get affected by the screen. So, for today's conversation, we are joined by a special guest, Dr. Vikram Premkumar, MD, DCH, DNB, Pediatrics, FSCI. So, let's get started. Thank you for joining us today. So, as a pediatrician, you meet many children daily. So, what are the biggest changes that you have noticed over the last decade in the children?
Okay. Before getting on to the question, let me come up with a small incident or a very interesting story which we can connect to our today's discussion topic. Just a month back, before the exam season, I had a parent who came into my clinic with their son who's around 13 years old. Now, the query, the question, or the concern for the parent was not that the child is suffering from fever, cough, or any illness. Their concern was the child is not able to focus. The parent said, Doctor, this is my son and he's not able to focus. Just few minutes into his studies, he's distracted by his phone. So I went ahead and had a discussion with the child. Now, this is not just one child. Understand? This is happening everywhere and this is happening in every single household. So, in future, or rather now, the question what we need to ask ourselves, or as parents, as teachers, as individuals, is not that are children intelligent? No. The question which is of concern now is, in future, will the children's brain will be tolerant enough to handle boredom, will be tolerant enough to stay focused, will be tolerant enough to accept silence.
So, what can parents realistically do because screens are everywhere?
Yes, absolutely. So getting back to the first question or the query which you had, what is the change which I am seeing or which I have seen during these past 10 years is the lifestyle change in children. The lifestyle change in the sense their dependency or rather acceptance of technology has been so great that it has brought a very transformative change in their day-to-day activities, day-to-day habits, day-to-day discipline.
Okay. How much screen exposure are children actually getting today?
Statistics are proving that the screen exposure has increased. A teenager, typical teenager, spends around not less than 5 to 7 hours a day on non-educational screen time. Okay, so that is really big. And when you come down to children who are younger, it's not restricted to adults alone or teenagers alone. Even kids who are 1 year old are kind of so screen dependent. Almost 2 to 3 hours per day for infants. So this is a major time of their day which is occupied by the screen.
Does screen affect children's mental health?
Of course it does. It does in a big way. It affects not just one sphere of their brain, it affects multiple spheres. For example, the sphere of being connected, the sphere of focusing, the sphere of being attentive, the sphere of being absorbing new things. So what happens is when the child is so much glued to the screen, their cognitive behavior, the cognitive development kind of gets hampered because they are totally disconnected with the environment. And as a human being, our senses needs to be fed not through just one source but different sources. We know we have different sense organs and all these sense organs are connected to our brain, and each and every sense organ needs to be stimulated for the proper development of the brain, which will lead to a proper growth of the child.
Okay. What role school can play in protecting child's mental health?
uh, Apart from parents, schools, we know, play a very important part of our life. It plays a very, very vital role, because school is the place where children learn not just discipline, but then school teaches them how to accept failures in life early in life, because not every student is a topper, not every student is a winner. You need technology, but schools can teach us where, how, and when we can use this technology in a most beneficial way.
If you had to give one message to the parents listening today, what would it be?
Children just mirror us. Our children mirror our children mirror us. So what is most important is for parents to understand children, and not just tell them to, you are not supposed to touch the phone, you're not supposed to watch the reels, or you're not supposed to get onto the social media, while as a parent you're doing that. So basically it's just discipline. Now children do not grow, or children do not learn from instructions alone. Children learn from experiences. Children learn from what they see. So as parents, the best what we can give to our children is, fine, we give them all luxuries, but at the same time we should give them some time. We should try to create memorable moments with them. We should try to prove to them that we are there for them all the time, and it's not just the screen which they should be dependent upon. I always tell my parents, my patients, that when you are with your family, try to create a scenario, or try to create some time when where there is no technology around. For example, as simple as when it's your meal time, be it breakfast, lunch, or dinner, or maybe all three, which would be absolutely wonderful, that it's screen free. It's the time where you need to connect with each other. Let's connect with each other, and not with the internet, or not with the technology.
Thank you, sir, for giving us your precious time.
Thank you so much. It was wonderful being here. And I truly appreciate that the school Amicus International has come up with such an interesting and forthcoming topic, which really is beneficial for the current generation and the generations to come.
Thank you, sir.
Thank you.